And I think patients get lost. They get referred to sleep medicine. They get the CPAP referral and they're told they can't do anything to fix themselves, which is an absolute. Anyways, we know that.
Sure.
So, and a lot of patients sometimes end up at a myofunctional therapist. And myofunctional therapists, they're just one piece of the puzzle. They're extremely important, but really we need to know what the whole picture we're dealing with. So
yeah, I think myofunctional therapists have to some degree served as sort of quarterback role, connecting patients with different providers in the space. But I have often found myofunctional therapists to be misguided around some of the details around how to actually make orthopedic changes safely and effectively. I have found them in general to be bullish on tooth-borne expansion and bearish on skeletal expansion and jaw surgery. And I think sometimes that sends patients down rabbit holes. You know, the diagnosis is usually great, but then the referral is oftentimes not so great. I personally suffered from that myself. So yeah, I don't love myofunctional therapists being the default treatment coordinator for that reason.
No, it's someone needs to make the master plan.
Yeah.
And it may not be the right time to even start with myofunctional therapy because their nose doesn't work.
Mm-hmm.
And the nose needs to work to be able to progress through myofunctional therapy because the first thing is establish nasal breathing, then lip seal, and then you move on from there. But if the nose doesn't work, and the 3-minute test, I think, is not the best test for can you breathe through your nose? But that's another story. Mm-hmm. But I think it's misguiding patients, like you were saying. I think great, you got into myo. It looks like there's structural things. Let's get a full picture.
Yeah.
But I think patients get lost in all of the different referrals. I just see it all the time, especially if a pediatrician's like, oh, let's get you to the ENT. Let's get you to sleep medicine. Your jaws look small, but we'll deal with that later. And I'm like, the jaw.
Yeah. I think that's another great point about the risk of having a myofunctional therapist first approach, which is that myofunctional therapists often give too much weight to the potential of myofunctional therapy in a patient with small jaws. They have this view in general, not all, but in general, that the tongue can adjust to any structure. That you can't, your jaws are small, but your tongue will learn to have good posture within a small palate. And sure, you can always make the most of what you have, but there are real limits to that.
Absolutely.
Especially if you can't even breathe through your nose, that's a non-starter.
Well, and if you have a small palate, you have a small nose.